Hello, I'm Dr. Robin Baran.
And I am Dr. Weber.
Some of you may have seen me on television for many years talking about the latest cataract developments. Our mission at the Columbuslaser and Cataract Center is to preserve, enhance, and improve vision. We feel the best way to do this is to offer the latest advances in eye surgery and to provide an accurate and honest education to our patients and their families.
We hope that this video will help explain cataracts and their treatments. As you watch, feel free to write down any questions you may have. We will discuss these together in a few moments. We strive to provide you with the safest, most effective surgical options. It is our sincere wish that you and your family members enjoy a rewarding quality of life as a result of these techniques. Before we begin, we would both like to say that while no technology exists to achieve perfect vision at all distances, we strive to meet as many of your visual goals as possible. The eye works like a camera. There is a lens that focuses light on the retina where images are transmitted to the brain. With a cataract, the lens becomes cloudy, causing images to be distorted, much like looking through an icy window. Cataracts are a common problem and are usually a result of the aging process. But some patients can develop cataracts at an early age, so any change in your vision should be investigated for the possibility of a cataract. Symptoms of a cataract can be very subtle in the early stages. The first signs are often difficulty driving, especially at night or in the rain, and problems with depth perception. As the cataract progresses, you may experience increased glare from bright sun or oncoming headlights.
Cataracts are treated surgically by replacing the cloudy lens with an artificial lens. In order to choose the best lens for each patient, we utilize advanced mathematical models to mimic the optics of your eye. It is important to note that not all eyes fall perfectly into these mathematical models. Therefore, when a discrepancy exists between the computer's expectations and how your eye responds, some form of visual correction will be necessary. It's important to remember that there are several factors that can affect your visual outcome after surgery. While the surgery usually takes less than 10 minutes, the healing process can take several months to achieve your expected visual outcome. Let me repeat that last sentence. The healing process can take several months to achieve your expected visual outcome, and if you need LASIK, it is done about 4 to 5 months after your cataract surgery. The surgical treatment of cataract has improved greatly in the last decade. Years ago, cataract surgery was performed through a 10 to 12 millimeter incision in the eye. This incision required 5 or 6 stitches and took months to heal. Current techniques allow surgery through an incision less than 3 millimeters or 1/8 of an inch incision. The smaller incision results in more rapid healing with minimal discomfort.
As new technologies arise, we continue to keep up to date and are happy to answer any questions you may have regarding these latest advances. Here's how cataract surgery is currently performed. A small incision is made in the front part of the eye called the cornea. Next, an opening is created in the anterior capsular membrane. The capsular membrane is much like a plastic bag that holds the lens in place. A small amount of saline solution is injected to separate the lens from this thin membrane. The next step is called phacoemulsification, where ultrasonic vibration is used to break the cataract into tiny pieces which are vacuumed from the eye. Finally, an artificial intraocular lens, or IOL, is inserted through the small incision and placed within the capsular membrane, which keeps it centered in the pupil.
Cataract surgery is one of the most successful procedures in medicine. However, as with any surgical procedure, risks exist and complications may occur. Most of these have medical or surgical treatments to help reduce the chance of permanent vision loss. Examples of these would be clouding of the capsular bag, infection, hemorrhage, tissue swelling, and retinal detachment. The most common of these is the clouding of the capsular membrane which surrounds the newly inserted lens. It is treated with a YAG laser, which is covered by your medical insurance, and you would be responsible for co-payments and deductibles. It is obviously impossible to discuss every potential problem. For this reason, it is very important that you be comfortable that your vision is significantly affected enough to proceed with surgery.
I hope this first part of our video has helped your understanding of the way in which cataract surgery is performed. Next, I'd like to take a moment to let you know that modern cataract surgery has become specialized into 2 different approaches. The first is called the standard approach. If you choose the standard lens, After your cataract surgery, you should expect to need bifocal or trifocal glasses. Your insurance and Medicare pay for this, except for your co-insurance and your deductibles. The second approach is called the premium cataract surgery. This premium cataract surgery includes a special lens, also includes specialized testing and complementary LASIK if you have any remaining refractive error after the surgery. However, your insurance and Medicare will not pay for these new special lenses and additional benefits. So let me attempt to repeat and simplify the present options. The first step is to decide which one of the following two generalized options you feel would work best for you. First, you are happy wearing bifocal or trifocal glasses and do not wish to pay for any premium cataract package. In this case, the standard insurance lens would be your choice. Or secondly, you want to lessen your dependence on glasses. As I stated earlier, if you choose this premium cataract package, your insurance will not pay for these services. Now, suppose you want the premium cataract package option. There are two basic types of premium lenses. The first type will give you good distance vision without glasses, but you'll probably need to wear glasses for computer and reading. The second type of lens will help you to be as free of glasses as possible. You strive for perfection in every cataract surgery, but paying extra for a premium cataract package does not exempt you from the inherent risks, but means you are getting the best technology to try to achieve the best possible results.
I know it is complicated, so let's review this one more time. The first option with the standard lens means that you will be happy wearing bifocal or trifocal glasses, and it does not require any additional out-of-pocket expense other than your copay and your deductible. The premium cataract package options have additional costs outside of what your insurance will cover. The additional fee is necessary to cover any additional cost of the premium lens implant, special testing, and extra treatment. Also, the premium cataract package options include complementary laser vision correction or LASIK to fine-tune your result if needed. This laser vision correction treatment is not to be confused with the YAG laser, which is often used months or years later to clear a cloudy lens capsule behind the lens implant. The YAG laser is done for medical necessity and thus it is covered by insurance, but as I stated earlier, your insurance may require you to pay a co-insurance and a deductible. If you choose one of the premium cataract packages and the small bag or capsular membrane that surrounds the new lens implant becomes cloudy, it is typically necessary to perform the YAG laser first before the LASIK laser vision correction is done. This is because we want to make sure that any remaining visual problems are not due to the clouding of the small capsular membrane. Remember, as we stated earlier, this entire careful process can take 4 to 5 months to get you to your desired visual goal. Once you have decided which option or goal you think is best for you, we will discuss how to best achieve it. I know that we have given you a lot of information, so let's review again the timeline and the process if you select a premium cataract package. Today's visit is your cataract evaluation. If you need cataract surgery, you will meet with one of our schedulers today. Normally, your surgery can be performed within 1 to 2 months. After your surgery, the normal post-op visits are at 1 day, 1 to 2 weeks, and at 3 months. If your capsular membrane becomes cloudy, which happens about 30 to 40% of our patients, it will require the YAG laser at least 3 months after your cataract surgery. This is charged to your insurance and you will probably have to pay your co-insurance and deductible. Finally, if you choose a premium cataract package and you still need some correction, you could have LASIK laser vision correction about 2 to 4 weeks after the YAG laser at no additional charge. It is a process. It is imperative that you understand that we are dealing with human tissue and not a piece of plastic. Consequently, there can never be any guarantees. The best results can take time and patience to achieve your final results. Please remember that we cannot emphasize enough that this is a process and may take 4 to 5 months. Risks are inherent in any surgical procedure. Fortunately, cataract surgery is one of the safest and most effective surgical procedures performed, and major risks are infrequent. The actual surgery only takes minutes, but the results are permanent and life-changing. We hope this has helped in your understanding of cataract surgery and hope to provide you with a very positive experience. Dr. Weber or I will be meeting with you soon to discuss your goals and what will work best for you and your eyes. You may have a free DVD copy of this video to review again at home. Just ask any of us.